Uh, so today I had the opportunity to read a letter directed to the Director General of the World Health Organization condemning the so-called pandemic treaty that essentially robs all citizens of the earth of bodily autonomy and sets in place a global secret government unaccountable really to any constitution or to any citizens of the world. I hope that this letter, that everyone can circulate it to their local elected official and all the elected officials in their country to formally sign. Anyone at the same time, any elected official who refuses to sign it should, I think, be considered as involved in this conspiracy for a total global takeover. And I'll share a link with that for that letter, which was drafted by American Congressman Chris Smith. So today, I want to sit down with James Roguski, who spent an enormous amount of time going over the pandemic treaty and its implications and keeping us up to date on the modifications of the amendments to try and get at the true nature of this transformation of global society. So please, James, tell us what is behind the letter, and even maybe more importantly, what is the true nature of the transformation that this so-called pandemic treaty has in store for us?
Um, that is a Gordian knot that we're going to try to untangle rather than just, knife through it and be done with it. So here goes. Um,
Please.
I heard something in what you said, and I'd like to pull on that strand first. Okay. And I think something that you said just before we started recording. So the point is, this is a relatively low bar. Okay. I think there's actually a lower bar that's not mentioned in the letter. And there are certainly higher bars and higher things that I, feel should be done as well. And sounds, from what I've had the chance to speak with you, that you also share a much higher bar. But I do think that this is the letter in question that Chris Smith wrote is essentially saying to Tedros Ghebreyesus, and this letter is expected to be delivered to the Director General of the WHO prior to the 77th World Health Assembly on Monday, the 27th of May. So, it's essentially a letter from any worldwide elected officials who would care to sign on to the letter saying, whoa, hold on just a moment. This is all being rushed through. No one has had a good chance to read what is potentially going to be agreed upon because they're still negotiating it. Now,
Right.
very specifically, with the amendments to the international health regulations, Article 55, paragraph 2 says very clearly that any nation or the Director General himself could propose amendments to the international health regulations, but they need to give 4-month warning. So
Right.
4 months would have been January 27th, 2024. That's, way past by now.
Right.
Just so everyone is clear, with the other agreement, the new pandemic agreement, pandemic treaty, framework convention for pandemic prevention, preparedness, and response, whatever name they want to give
Right.
it,
Right.
it does not have that same 4-month requirement. This is a new document. They're going to discuss it. The nations could vote to adopt it, but then there would be signatures required for nations to join. And this becomes, and this is the core of the question for me. There's an enormous difference, and I think almost everyone has confused the two things that I'm going to try to differentiate, not just the two different agreements, but the difference between national sovereignty and the loss or expression of it, and within each nation, how nations use that national sovereignty as a club against their own individual people.
Right,
And
right.
all of those things have gotten mushed together with a lot of confusion. And the starting point should be, we can talk about old documents. You can add old information to miss, dis, and mal information,
Right.
because many people have been talking about old documents as if that's what's on the table now. Now,
Ah,
we don't know what's on the table. That's the problem.
so
And
the
so
the
what
actual
Chris
text being debated, discussed right now, there's no copy that circulated, nothing you can see,
the
draft.
latest version, I believe, is for the amendments,
Right.
was from April 17th of 2024, and the latest unofficial version of the treaty, but I trust that it's a true version, was May 10th. And there have been many, many, many negotiations since then. So, I don't even know, the way all of this is crazy and it's a big soap opera. I wonder if even the delegates who are participating in these negotiations have a clean copy. And you have to realize there's 194 nations that are members. Two other nations, the Vatican and Liechtenstein, additionally are party to the regulation. So there's 196. And the WHO only supports 6 languages. So, oh my God, a lot of things will get lost in translation for many of the delegations.
Right.
Um,
Right.
so the letter from Chris Smith, which I published yesterday and shared with you, um, is something he's going to be talking about, quite frankly, as we speak right now. They're supposed to be
Right.
having a press conference. So I'm here talking to you. I'll have to watch the recording of the press conference. Um, he's essentially saying, hey, 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 slow down. What's your rush? Right? Why are you trying to ram this through? Okay.
Right.
Now, there's bars that are even lower than this, and
Right.
there are some that are much higher. So wherever you want to go with the conversation, hopefully that sets the playing field here.
Well, it helps a lot for me to understand, and I think for others, uh, how what the landscape is. It certainly gives it also a sense of just how confusing it is for the man or the woman in the street, especially if you're working 2 jobs and trying to feed your kids, try and follow what's actually happening in these aerial spaces. When you discuss this process, I'm reminded, there's a quote Thomas Mann said that, just because something's insipid doesn't mean it can't be dangerous. Um, so it may be banal, may be stupid, it may be repetitive, poorly written, but the implications can be quite dire.
I would be happy to try to super simplify it.
Please,
It's 10 after the hour right now. Let's see if I can do this in less than 5 minutes.
much
Okay.
appreciated.
Um, I believe that universally, all of the people in the room and circling around the room in terms of negotiations, because a lot of it is done virtually, but the players involved, I have not heard a single word of dissent in regards to what I'm about to say. Okay. In my humble opinion, okay, the core assumptions, the fundamental premises that are driving these negotiations need to be challenged very, strongly.
All right,
They believe that diagnostics, drugs, and jabs are the way to prevent and prepare for the next pandemic.
all right,
And they're unwilling to challenge either of those things, because if you looked at how this really is, the WHO's budget is maybe $4 billion a year. A lot of money for you and I, but not
for
really
them,
that
it's
much.
nothing.
Now, the people around the table are delegates of 194 to 196 nations. Many of those nations, their assessed payments to to buy a seat at the table, if you will. Okay. George Carlin, it's a big club and you're not in it. Well, it's not a big club, George. It's a small club. There's only 194 people who get to, really be involved in the negotiations. And so many of those countries, the dues that they pay, this is shocking, is,
Right.
five, 10, $20,000 a year.
Right.
So to get a seat at the table is relatively inexpensive.
Right. Right.
If you vote properly and you negotiate an agreement that might result in tens of millions of dollars of investment being directed to your country, you
Right.
can then understand why they all want to be involved in these negotiations
Right.
and they want to reach an agreement. You've got the United States, the European Union, the United Kingdom, Australia, Canada, Germany, throwing money into a set of funds that
Right.
will be redirected to the people who are willing to play ball.
Right. Right.
This is a financial deal. And what's being ignored is that number one, the RT-PCR test is not a test. It
Right.
was a fraudulent act perpetrated upon the world to get people to believe that there was a measurable contagion that you might be spreading even though you did not have any symptoms. I view the use of the PCR test as a fraud upon the world. Number two, drugs like midazolam and what I call remdesivir, right? Um, those did not improve the health of anyone on the planet. The
Correct.
protocols that were accepted by the official whomever were more likely, premeditated murder than they were something that actually helped people prevent or deal with a respiratory ailment.
Right.
And at this point in time, if anyone can look at the mRNA or the other forms of the jabs that were used,
Right.
they weren't even studied to stop infection or transmission. They
Mhm.
didn't work. They had to change the definition on the CDC website of a vaccine because they realized it wasn't working.
Not a
And
vaccine.
it's not a vaccine. Well, again, if you change the definition, anything can mean
Mhm.
anything. And so um,
Is
it
that true now?
caused it
Vaccine
it it
can mean
caused
anything now?
well, there's a specific definition, but it causes an immune dysfunction, okay?
Right.
And has, been associated with adverse events, disease, disability, and death, both sudden and excess. And so the reason why these negotiations are happening is the relatively poor nations around the world got together on December 1st of 2021 and requested that the WHO oversee negotiations because they felt they weren't getting their fair share of these fraudulent and dangerous pharmaceutical products that they call pandemic related products. So
Right.
if you don't challenge the premise,
Hmm.
then none of this makes sense. Okay.
Right.
And when you look at it as a business deal, where oligarchs from smaller nations who would profit from testing laboratories and the equipment involved and labs to do all of the processing of the PCR test and drug makers and vaccine makers, they want the wealthy nations to put a whole bunch of money, $30 billion a year, to invest in geographically distributed manufacturing
Right.
of products that don't work and cause harm, not because they want to help their people be healthier, but because they missed out on the profits. If
Right.
you use Omicron as an example, when South Africa handed over what was purported to be the genetic sequence, and Pfizer and Moderna put that into the boosters, they're
Right.
like, hey, wait a minute. You just pirated our intellectual property, our biological resource, and as an expression of their sovereignty, they
Right,
said, we're never doing that again. We're not going to put our genetic information that we found in our country, hand it over to you so you can make billions and we don't get any piece of it.
right,
So I'm over my 5 minute limit by a minute. The point is, these negotiations are not what people think they are.
right,
They're not in danger of failing because of anything I've done or anything anyone else has done. They're in danger of failing because all of the small countries are
right,
not able to extract a piece of the pie from the
right,
big countries who are shilling for big pharma.
right,
So the beast over the top of all of this is big pharma,
right,
who doesn't want to give up, their profits,
right,
battling with small pharma around the world who wants a piece of the pie.
right,
And if you don't understand why they're doing this, it's not about national sovereignty. It's not about Tedros trying to take over your healthcare system. Big pharma has already taken over your healthcare system 100 years ago. Wake up.
right,
They're trying they're trying to control the build out of their industry with your money.
right,
And until you realize what this really is, it's going to be very, very confusing. But once you realize it's an attempt to set up, what I call the new OPEC. OPEC is the oil producing and exporting countries. This is the Organization of Pandemic Emergency Corporations.
right.
And so I'm way over my 5 minute limit, but hopefully that's a good enough summary.
Very, very well summed up. I'm in a way reminded of the military-industrial complex in the United States, which works in a similar way and has factories spread out all over in every state, so that even uh, congressmen who are opposed to military spending have no choice but to support bills because the only factory left in their in their uh, in their district is producing weapons or armaments. So
May I take off on that? Okay, because approximately a year ago,
mhm,
former Secretary of Health and Human Services Alex Azar was interviewed at the Aspen at an Aspen Group's
right,
meeting, and this is about a year ago. He said, "Oh, well, just recently, the Department of Health and Human Services received control over what's going on with COVID, which was only just then relinquished from the Defense Department."
right,
So your mentioning the Defense Department in this context is exactly appropriate because this was a Defense Department operation up until the time that the public health emergency was called to an end and the
right,
national emergency was called to an end. And then it went back into Health and Human Services. At that same meeting,
mhm,
they interviewed Javier Becerra, who's the current Secretary of Health and Human Services.
right,
They asked him very clearly, what would you like the American public to know about the Department of Health and Human Services? And he didn't hesitate at all. He's like, oh, I want everyone to know that the federal government does not have any authority whatsoever over healthcare. We have a lot of money,
right,
and people like the benefits of Medicare and Medicaid and Obamacare and whatever other programs they may have. So it's not that the federal government can force anybody to do anything, but if you're a hospital administrator and the federal government says, well, we have requirements on Medicare payments,
right,
so we want you to do this, and this, or we're going to withhold, for you, we're not going to cover Medicare unless you meet these requirements. Everybody's got to be tested for COVID. You use
right,
remdesivir. Okay. So it's money that controls the hospital protocols, not legal or lawful authority. And then Sebelius, the uh, Secretary of Health and Human Services under Obama, man, did she let out a bombshell. she said, well, around the world, many nations don't like to see military boots on the ground.
Right.
So Health and Human Services has employees on the ground in however many dozens of countries around the world as, diplomats. Now, I don't know if you saw the movie Sound of Freedom. It's about human trafficking
It's
and
all
so
just
forth.
the trailer.
Okay. Spoiler alert. Okay. My apologies for anyone who hasn't seen the movie. uh, they're trying to infiltrate the evildoers headquarters, in the jungle.
Right.
And the way they managed to infiltrate was they sent a boatload of doctors to hand out vaccinations. And so,
Like a comedy.
this was actually, I believe, recorded 5 years ago.
Right.
And so, even evildoers are
Mm.
willing to accept, medical personnel to save them from harmful disease by
Right.
injecting the poison in
Right.
their arm. Interesting, side note on the movie. Sorry if I spoiled it for anybody. I felt like I was the only one in the theater who noticed, how they did that. It was so obvious.
Right.
So the point with Sebelius was they have boots on the ground in the
Mhm.
form of medical personnel. Now,
Right.
that goes hand in hand with the Defense Department's global health security agenda, which they came out with a document recently, similar global health security strategy.
Right.
And goes all the way back to the Obama administration. But in 2022, in December, the Congress passed and Biden signed the National Defense Authorization Act. And in there, the US pledged $5 billion over 5 years
Right.
to the World Bank Pandemic Fund. And what that fund has been doing is distributing hundreds of millions of dollars to countries around the world. I think in 2023, they gave out 340 million to 37 different countries.
Right.
So these are the contracts that I'm talking about where, if a nation decides that they want to participate and
Mm.
want to receive tens of millions of dollars to build out laboratories, what the United States is doing, the Defense Department, through the World Bank Pandemic Fund, is what the WHO and all of the other nations are trying to set up through the pandemic treaty, which
Right.
is here's a bunch of money, go look for pathogens in your
Right.
community.
Right.
Normally that's found in excrement. Okay.
Right.
You could test the septic or sewage treatment systems. You
Right.
could test, something up your nose or any other bodily orifice, or at a veterinarian's office, you have a stool sample from your pet or your chicken coop or your pigsty or your, dairy farm,
They
right?
have like a
So,
herbarium for all these things they
there
find.
you go. And so what the WHO is trying to set up, they call it One Health surveillance, but it's essentially biological weapons research and
Right. Right.
development.
Right.
Let's go into a bat cave and collect some guano and see what
Right.
kind of crazy stuff we can find, or
Right.
kangaroos or koalas in Australia or
Right.
orangutans in Borneo, whatever. Um, if we can find something that looks like it has pandemic potential, and they literally define the
PP.
term pathogens with pandemic potential.
PPE.
I use four P's. Okay. Pathogens with pandemic profiteering potential. Okay. Let's bring that into the WHO coordinated laboratory network,
Right.
isolate or manufacture a genetic sequence that looks like it's dangerous,
Right.
send it off to the central hub in Switzerland or Berlin, share it with whatever corporations think that they can make a product out of that. If a
Right.
product gets made and goes into the WHO distribution and logistics network, they talk proudly about just one of their facilities. They have a 20,000 square meter distribution hub in Dubai. That's 4 football fields.
Right.
Can
Right.
you imagine how much money it would take to hand out the contracts to fill 4 football fields with pandemic-related products for future use. Okay, there's warehouses stacked to the ceiling with things that don't work. Look for
Right.
an article for me coming soon about Tamiflu, right? Billions of dollars, put into the pharmaceutical industry for a product that, doesn't work and causes harm. So this business deal, this corrupt cabal of manufacturing of products that ultimately harm people is not being questioned by anyone in these negotiations, because that would be, killing the goose that's laying golden eggs all over the place.
Right. Right.
And so the discussion that this is an attack on national sovereignty, or that this is a coup by the WHO to take over nations' healthcare, misses the point. Big Pharma, or Pharmakia, has already done both of those things.
Right. Right.
And the WHO is the tail that's being wagged by the big dogs in big pharma. And our ambassador Pamela Hamamoto, in regards to the treaty, and people like Colin McIff and Lois Pace and others in the Office of Global Affairs in the in the Department of Health and Human Services, are essentially shilling for
Right.
big pharma interests.
Right.
And the little guys want a piece of the pie, the big guys don't want to give it,
Right.
but the pie is filled with poison.
Right. 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 Well, that's a nice summary of the larger picture. I guess I wanted to say, I mean, if we look back on this from the late '90s in DARPA, so in Department of
Mhm,
Defense, there were a series of classified research papers. I mean, basically identifying three areas: nanotechnology, biotechnology, and information
mhm,
technology is a sort of emerging fields. Enormous amount of investment was done, and essentially DARPA, if you go to DARPA website today, it's like a third of it is all about biomedical. I mean, DARPA is no longer in the defense business. It's now, it might as well be uh, UCSF, or it seems like a medical research institute.
well, they're on the offensive at this point. I mean, they're coming for us. And
Yeah, no, I
um,
agree. Uh,
yeah.
so it's literally when you said the boots on the ground, it is it's not an exaggeration. It's not even a metaphor. It's literal. And I
Mhm,
would also note that we have a lot of trouble with secret governance in the United States. Started, of course, in Department of Defense and intelligence agencies, but
mhm,
it's been extended now to Department of Energy, now into uh, um, Department of Treasury, and in health. And I assume they're probably increasingly having classified directives, classified materials, so that Health and Human Services itself can be essentially taken over by the military, and people working there are no longer at liberty to disclose to you what operations they may be involved in.
And don't forget the Ministry of Truth, known as the mainstream media, where
So no,
the information about you know the fear mongering, scare tactics used to talk about whether it's bird flu or swine flu or whatever it may be, and the quite blatant lies about, oh, you've got to get tested, oh, you got to follow protocol, oh, everybody's got to get jabbed. That's just fancy marketing for big pharma.
right,
Brought to you by Pfizer, right? Almost everything on television is brought to you by some pharmaceutical company. And so when you realize that pharma, in order to get licensed, has to pay fees that, whatever the number may be for the FDA, it might be around upwards of 50% of their budget,
right,
comes from the fees to consider new drugs.
right, right,
Well, when somebody steps up and says, hey, wait a minute, I'm dealing with this individual patient, and the protocol for that patient that's ideal and unique for them is not in alignment with big pharma's, money-making protocol. When you realize which protocols were accepted, uh, I don't know. It depends on which hospital you might be in, but putting someone on midazolam and sticking a ventilator tube down their throat is thousands of dollars a day.
Right.
Remdesivir, the whole course was, 3 to 5 thousand, maybe even more. There were bonuses given if, everyone was given a COVID test, which again is fraudulent. So when you're incentivizing bad behavior,
Right.
borderline premeditated murder,
Right.
okay, and in many cases, way past the border
Yeah.
because people died, when simple solutions to health issues that were identified by various doctors all around the world were attacked,
Right.
okay, you have to step back and go, wait a minute, this system is corrupt, and it has been for decades. And I don't know if this is of interest to you. It's a question that I just have not ever really had the time to sit down and dig into. But if you go back to the 60s, when Medicare and Medicaid began and the government really started getting involved in paying for healthcare, if you look at the tiny little bit of taxes relative to everything else that are taken out of people's paychecks for quote unquote, healthcare, Medicare, Medicaid, whatever, and you add up all of the taxes that have been collected from
Right.
the federal government for what they call health care, and then you add up all of the expenditures for
Mhm.
Medicare, Medicaid, Obamacare, all of the other things, all of the Department of Health and Human Services and so forth. If you subtracted the money collected from the money spent, I
Right.
bet I bet you'd get pretty close to the 35 or so trillion-dollar national debt.
Mm.
Our debt can be attributed to the Defense Department to a certain degree,
Right.
but big pharma is, 4 or 5
Oh,
times
wait, no,
larger.
that's certainly true. And I mean, it's as I was suggesting, they are merging. That originally from the DARPA efforts, it sort of identified bio as an emerging field for security. The usage of the word you mentioned of security within the treaty and related DoD efforts, and I really do appreciate your taking the time to explain for everybody here what's actually happening. I want to just make a comment that I feel a lot of this has to do with the death of science. That we've people have confused technology with science, and this has seriously eroded our ability to assess what's effective, what's real, and so it's become very performative, very effect the technological whistles, bells and whistles type impressive pictures and videos, but very little science.
Mhm. One of the things that I did months ago was put together the People's Declaration. You can go to thepeoplesdeclaration.com. And if you recognize that these negotiations are essentially trying to entrench a global
Right,
research and development and proliferation of biological weapons
right,
infrastructure,
right.
the only answer is stop. You people are headed in the wrong direction.
Well, for
Yes,
sure, sure.
I understand the illogic of, oh, well, we've got to find these pathogens before they cause a problem. And maybe our enemies are doing the same thing and they're developing biological weapons. So we have to do it first. Okay.
Right,
And I get the concept of, oh, if you're in warfare and your enemy has a biological weapon and you could develop, a protection or a vaccine for your troops, you could go into war and not be attacked on a biological warfare protocol. But they're doing this against people.
right. No, I
They're
agree.
they're
Right,
taking weapons research and they're saying, well, we have to find pathogens that are not causing pandemics, and they're trying to change the definition of the word pandemic. They're not causing a problem. They're pathogens with pandemic potential. What an opportunity to profiteer. Let's go
Right,
find something that isn't causing a problem yet, but it might,
right,
and create a toxin, whether it's, the jabs cause damage to the underside of your brain. And I've spoken with people whose lives were devastated by just getting that. And
right,
and so when the treatment or the testing, the treatment, and the prevention in the form of a jab all actually serve to damage people's health.
right,
I've looked at those products, the testing, the drugs, and the jabs for decades, not as, health enhancing, but those are customer acquisition tools for big
right,
pharma. If you
right,
can take a healthy person, stick something up and damage them, and take the genetic material and go develop something from it, and tell them, oh, you need to take a drug, or you need to get a jab because you're a danger to society because our fake test said so. You've got an asymptomatic disease, and you can be, forced to do some sort of prophylaxis or vaccine,
right,
or be isolated or quarantined. That's at the very least fraud. At one level, it's assault and battery,
right.
and it quickly degrades, into murder for all of the people who
Or
have died at the
warfare,
hand.
I would say.
Yeah.
Um, but I mean, it reminds me of the old saying that to think that pharmaceutical companies are interested in health is like thinking that weapons manufacturers are interested in peace.
Mhm. Yep.
But anyway, thank you very much for
Thank
explaining
you.
the background for the treaty and what's really going on around the world. And I really feel strongly that we have to, as citizens, not only understand the pandemic treaty, but understand how our country really works, and be scientific in our thinking, both about disease and about the nature of governance.
Thank you very much, Femi. I appreciate it.
We'll talk again very soon. Thank you, James.
Thank you.